Actually, they're called progressive lenses now, apparently, so not trifocals. Can you see it? All right, excellent. All right, so they bring me in after all this technical stuff here, and I get to talk about poop and gas and bloating and things to do about it. But I come to this topic from 24 years of chronic gut problems. I was 20 years old when I had my very first colonoscopy. I was at college. I've had 4 colonoscopies, multiple endoscopies, barium swallows, barium enemas, all kinds of procedures from gastroenterologists, all from irritable bowel syndrome, gas, diarrhea, bloating, all the things that come with that. And I was told, well, you're just nervous, Dani, you need to calm down. And I said, well, yeah, I'm nervous. I mean, I can't go through a meal without pooping my brains out in a restaurant or wherever. And so for years I struggled with this and chronic itching. I've got scars on my arms from horrible urticaria, itching. And nobody, it was, 20 to 44. I was 44 years old when I got out of nurse practitioner school. And Dr. Kalb, where I worked for the last 4.5 years, he said, Dani, what do you eat? Do you know your food sensitivities? Do you take digestive enzymes? And do you take probiotics? Something no one in 24 years, multiple doctors, had ever said to me. I said, well, I eat anything I want. I have no idea what you're talking about. Food sensitivities. And Vanderbilt and the hundreds of thousands of dollars I spent there on education never once mentioned digestive enzymes or probiotics. So for the last 4.5 years, I have dedicated my practice to really starting to help patients heal the gut. And this is where it starts. 80% of your immune system is in the gut. When I did my food sensitivity testing, out of 96 foods, there were 29 that I was eating that my body was reacting to. Salmon was on it. Green beans were on it. Coffee, which was the most devastating to me, was on it. So good food can be hurting you. And that's what this whole talk is about, is when you heal the gut, you start to heal everything else, 75 to 80% of what's going on in your body. All right, so, what happened to our gut? Well, during the Industrial Revolution, this is when we, refined sugar, refined flour, all the white things came into play. Frozen, packaged, processed, bagged, canned, boxed, tubed, rolled foods. Fake foods, basically. If you have to open it up out of a package, a can, a box, a tube, a roll, it's fake food. If it was made in a plant and didn't come from a plant, most likely it's hurting you. And it's full of processed foods, or processed products, I'm sorry. Between the ages of 12 and 29, this is what the average American consumes, which I find fascinating to me. I come from a real small town in western Kentucky, so I can believe this. This is the kind of food I grew up on right here. And some of the contributing factors, to leaky gut, to irritable bowel syndrome, things we're going to talk about today, stress, NSAIDs, antibiotics, environmental toxins, heavy metals in your mouth. It could be, you grew up near herbicides, pesticides being sprayed on fields, chemical plants. You live downwind from chemical plants. It could be all kinds of things environmentally. I found this fascinating from the CDC, that we are raising the first generation of children that are going to die before their parents. And that's scary to me. And I've got a 17 and an 18-year-old, and they're in pretty good health overall. But if I had to do it all over again, I would have changed things when they were little. I didn't feed them horribly, but I didn't know. I didn't know what I was feeding them. I didn't know that even though it was, Tyson chicken nuggets, I really would have changed things a little bit. 17%, 12.5 million children and adolescents are obese between the ages of 2 and 19. I mean, that's unacceptable to me. So we're going to talk a little bit about digestion 101. Eating, digestion, absorption, assimilation, and the elimination of waste. I cut this talk down from two hours, which was about 100 and something slides, down to 39. So I've cut a bunch of things out of this. I'm going to try to keep it within 40 minutes here. So the digestive process, we start with eating, we start with making food choices. This starts in the mind, starts in the mouth. And this is the portal for all nutrients, good or bad, that come into the body. And then we start to digest it. And that starts in the stomach, the small intestine, sometimes in the mouth, in the saliva. And, the parotid glands release digestive enzymes, and we don't chew enough at all. We just inhale our food. I've laughed multiple times if something I eat too fast. If something happened to me and they did a autopsy on me, they'd be horrified at the undigested food because I just inhale it a lot of times. But we need to chew. We need to release those enzymes. Those are the natural enzymes that we don't have to take that start to break food down. And then we absorb it in the small intestine, the large intestine, the bloodstream, and the liver. And we assimilate it. That's a cellular level in the cell, and that's where they enter the cells, and it's used for energy and storage and things like that. And then we eliminate it through the colon, the kidneys, the skin. This is the skin, the largest organ on the body. So you need to be real careful what you put on it and what you put in your body. And this is where waste is excreted. And this talks a little bit about proton pump inhibitors. I don't know. I've been on multiple proton pump inhibitors through the years, Nexium being one of them. It blocks stomach acid. As providers last year, we wrote over 114 million prescriptions for proton pump inhibitors. $5.1 billion alone just for Nexium was spent. The FDA has issued a warning on it for the prolonged use of proton pump inhibitors, increasing the risk of infection, bone fractures, and dementia. And this comes from chriskesser.com. I don't know if you're familiar with him, but he's a fabulous provider on the internet who has a great blog and really good newsletters that come out. So then a little bit about the pancreas. We're working our way down. The pancreas, this is where digestive enzymes are made. Amylase, lipase, protease, breaking down fat, starches, and protein. And, of course, insulin and bicarb is made in the pancreas. Then you get into the small intestines, and these are, somewhere around 15 to 20 feet long. You've got hundreds of microvilli there that cover the small intestine. We produce digestive enzymes in there as well. We absorb nutrients. And it also blocks the absorption of non-nutrients. So the small intestines, it's been said, it's the key to a healthy digestive tract and immune system. Basically, it's the holding tank. All right, holds things in until they break down. Oftentimes, keeps food in place. It's kind of like the skin, keeps good things in, bad things out, hopefully. If you have a lot of bloating and gas sometimes, after you eat, oftentimes that's, food's going right into the small intestines. This is where digestive enzymes come into play for me. I take digestive enzymes and I take probiotics every day. I can tell, though, when I miss my digestive enzymes more so than when I miss my probiotics. For me, enzymes are immediate, breaking down food, breaking down fats and protein, mainly. So, the liver, we go through the small intestine, then, we have the liver is connected here to the gut as well. And this is the liver is one of the greatest organs, but it does have a finite functioning capacity. So you can't abuse it forever. Lots and lots of things are processed through the liver. When the GI system is abused, oftentimes the liver doesn't function as properly as it should. This is a real serious problem. There's over 300,000 new chemicals every year that are listed each year in the United States. We consume 14 pounds of food additives a year. 70,000 toxins are used in foods, drugs, and pesticides every year. If the liver can't detoxify these chemicals and detoxify your body, those chemicals are stored in tissues throughout the body, which in turn increase inflammation. And we know that inflammation is the root of so many problems that are going on in the United States. And then we move down to the gallbladder, which stores and concentrates bile. Bile emulsifies fat, cholesterol, and fat-soluble vitamins. If it becomes too concentrated, then you get into stones. And gallbladder disease is directly associated with your diet as well. Anybody in here have gallbladder problems or ever done a gallbladder flush or a liver cleanse? No? Yeah. So then the large intestine, and this is where we absorb water, or it absorbs water, and the remaining nutrition, and this is where the stool forms, all right? This is where you have a lot of your intestinal bacteria as well, produces your vitamins A, B, and K, your butyric acid that Dr. Lokensgard talked about. This is oftentimes a deficiency in that is associated with colon cancer and irritable bowel disease. I thought this was pretty interesting. The Western diet produces, about 5 ounces of stool a day, but a traditional African diet, Africans in Africa eating the traditional diet produce about 16 ounces of stool a day. That's amazing to me. I tell my patients, you should poop like a dog. Every time a dog eats, they go outside and poop. That's what we should be doing as well. When you eat, you should poop a little bit later. If you're not pooping 2 or 3 times a day, then you're constipated, whether you believe it or not. Dr. Jonathan Wright, who's like the leader and one of my favorite physicians out there, he's a leader in nutritional therapy. I was at a conference and he made this quote, "The larger the stool, the smaller the hospital." I loved it. I know, I thought that was great. So then you get into intestinal flora, your bacteria. The total amount of intestinal flora weighs up to about 4 pounds, the size of the liver. So it's a whole colony. It's basically a whole nother organ in there. Over 400, 500 types of bacteria in the gut. I tell patients this every day. Food either heals you or it kills you. It's as simple as that. You have to make really good choices. Is this food going to heal my body or is it going to kill my body? Our bodies are made to heal themselves, but you have to give it what it needs. Dr. Lokensgard talked a little bit about dysbiosis and symbiosis. We skip symbiosis. That's when everything's great and everything's in order and everybody's living in harmony in there, all the bacteria. Most of my patients don't have a lot of that. They have a lot of dysbiosis. Several different reasons for dysbiosis. Constant high levels of stress, increased inflammation, exposure to manufactured chemicals, poor food choices, birth control, and I'm going to talk a little bit tomorrow about birth control as a drug mugger with the thyroid health. Surgeries, antibiotics, lots of antibiotics cause dysbiosis. And then we get into leaky gut. And leaky gut is the key for me and pretty much what I do in my office. This is where you've got increased intestinal permeability, where you have food that's coming out and going in, undigested food. The gap junctions should be very tight like this. Your gut is made up of these gap junctions, and food should not be, or things should not be coming back in. What happens is through years and years of stress, through antibiotics, all the things we talked about, those gap junctions open up and they get loose, all right? And that's where toxins go out. Sometimes undigested food particles leak out into the bloodstream, starts causing inflammation. Well, here it is right here. I didn't have to explain it. So those little gap junctions open up. That starts the leaky gut. In turn, that turns on food intolerances, can lead to immune abnormalities, and then you get into autoimmune conditions, which is what I deal with a lot with thyroid problems and MS and rheumatoid arthritis, all those autoimmune conditions that can happen from an inflamed gut. Because when the gut's inflamed, the body's inflamed. These are a lot of symptoms that are associated, and there's even more than this that's associated with leaky gut. And again, I tell patients every day, they don't think that their mood swings, their depression, their joint pain, their skin rashes, muscle pain, fuzzy thinking, things like that. Most patients associate gut problems with diarrhea, constipation, bloating, gas, things like that. They don't realize that, 70 to 90% of the serotonin in your body is located in the gut. So when the gut's inflamed, so are the symptoms of anxiety, depression, schizophrenia, bipolar. There's lots of research on things like that. When you start to heal the gut, you start to improve psych symptoms as well. Joint pain for me, I went through 20-something years of struggling with gut issues and doctor after doctor, and then I was 31 and diagnosed with lupus, 32, with 2 little babies, and it was joint pain. Joint pain in the hands were horrible for me. Well, it wasn't it was lupus. I had horrific lupus antibodies. But really what it was my immune system was turned on from such a poor gut, and all these years of eating. I can't tell you how many cans of chocolate frosting. Betty Crocker frosting. When I'd get stressed, I'd eat chocolate frosting, which is horrible for you. Years of stuff like that. No doctor ever acknowledged that, Dani, you might want to put the spoon down when you get stressed, and go exercise. And all of this whole cascade of 20-something years of a bad diet, a mouthful of amalgams, 12 amalgams in my mouth, mercury fillings in my mouth, growing up in western Kentucky near the chemical plant, the uranium plant, USEC, had turned on my immune system. And then I was diagnosed with lupus and told, you're going to hurt forever, Dani. You just need to make sure you exercise. You're going to wax and wane. Well, as of January, not one antibody is detectable in my body. Lupus antibodies are detectable, which was amazing. It took 4.5 years, and thank you, 4.5 years of working hard, and I'm still not perfect. I got so stressed out last night, I ate M&Ms. I haven't had M&Ms in forever. Probably one of the reasons I don't feel good today. But I went from 29 foods on my food sensitivity down to 16 in January. Now, I still have a pretty bad leaky gut, but thank goodness coffee's off of it now, and salmon. And then I added bananas. Bananas are on it. So you build sensitivities and you build food, leaky gut and, inflammation up to foods that you eat more than 2 days in a row. So I was putting a banana in my protein shake every morning thinking I was doing well. Well, then I built a sensitivity up to that. So now I'm trying to cut back on bananas. And these are some of the chronic diseases. Those were symptoms. These are the diseases that are associated with leaky gut. Rheumatoid arthritis, Hashimoto's thyroiditis, anything that ends in itis. Of course, itis means inflammation. So why are you inflamed? And that's what we have to tease it back to. When I first started this, I always brought it back to the gut because I really didn't know what I was doing. I graduated from Vanderbilt. I was not taught anything about integrative medicine or ever told anything about healing the body or, the mind, body, spirit connection. So I always brought it back to the gut is what I did, trying to buy myself some time to figure out what in the heck's going on with these people. Well, in hindsight, as I practice more and more now, well, that's where you start anyway. Is the gut. You start in the gut and then you work your way out. And if your symptoms don't improve, then we dig even deeper. But your migraines and your toenail fungus, psoriasis, eczema, the skin, the health of the gut is directly related. No, that's a lie. The health of the skin is directly related to the health of the gut. So what's going on the outside of the skin with your eczema, your chronic itching, your psoriasis, your rosacea, that is completely related to the health and how inflamed your gut is. So what causes it? We've talked a little bit about this. Environmental stuff, toxins, bad food, the standard American diet, low fiber, processed foods, medications, zinc deficiency. Zinc is critical for the lining of the gut. So what do we do about it? Number one, first thing I do is I find out people's food sensitivities. If they can't do a food sensitivity test, then I have them do an elimination diet. We start with cutting out the top 7 foods in the country, which are gluten, dairy, soy, corn, sugar, eggs, and peanuts. Those are the top 7 inflammatory foods. Not everybody's sensitive to those. Gluten's not even on my list, but eggs are the highest. And yeast. So it's real difficult to eat gluten without yeast most of the time. So I stay gluten-free as much as possible. But we find the food sensitivities. You get a high-quality digestive enzyme in there. I take the enzymes before the meals to help break down the proteins and the fats. Pre- and probiotics. L-glutamine to help cool the gut down. hydrochloric acid with pepsin. Dr. Lokensgard talked a little bit about hydrochloric acid. Zinc, yeast killers, D3, fish oils, B12. A lot of patients with if you're on a proton pump inhibitor, if you are on something to block acid, you need to be on B12 because it will decrease your B12 in your body. We've already talked about this. You heal the gut before you begin to heal the body. There's a book, if anybody struggles with anxiety and depression, one of the greatest books that I've ever read is called The Mood Cure by Julia Ross. This is on healing the gut. You heal the symptoms of anxiety and depression. I work with an integrative psychiatrist here in town called, his name's Dr. Doug Imsch. He turned me on to that book, and it is brilliant on healing the gut, getting the amino acids back in your body, get the nutrients back in your body that you need to decrease the symptoms of anxiety and depression. And she also has the mood diet, the mood cure and the mood diet. So then we're going to talk a little bit about irritable bowel and some GERD problems, 10 to 20% worldwide. Well, why is it irritable? Most of the time it's what you're putting in your gut is the reason it's irritable. I thought this was interesting. Anxiety and depression are increased with IBS. But, which came first, the chicken or the egg? I don't know. I don't know that answer. Reflux. Anybody, and I lived with this for years, chew your food thoroughly, not a lot of large meals at night, sugar, caffeine, alcohol, all those things that we know increase reflux. Know your food sensitivities. Get your hydrochloric acid in there. He talked about, generally we think that it's too much acid that's causing the problems, but oftentimes it is hypochlorhydria. And, hydrochloric acid with pepsin, I can't tell you how many patients of mine do so much better when they take this. Some licorice as well. So, treatments of IBS, so oftentimes or integratively, we use, food sensitivities, avoid sugar and caffeine. Peppermint oil works great. There's been some research on melatonin and 5-HTP. 5-HTP is a precursor to serotonin in your body. And I use a lot of this with patients. The side effect of 5-HTP is that it also decreases carb and sugar cravings. So it's really kind of a double whammy. Dr. Oz says you should take it during the daytime with your meals, but I tried it and it makes me so sleepy. I can't function. So I must be very sensitive to it. I take about 100 milligrams at night a lot of times. Probiotics. And there's been a little bit of early research that artichoke leaf extract is good as well for symptoms of IBS, but I don't know anything about artichoke leaf extract, so we'd have to ask Dr. Lokensgard and Dr. Roberts maybe. So here's what we do. What do we do to heal the gut? We remove it, we repair it, we replace it, and we re-inoculate. So we're going to remove the potential toxins. We already talked about that. Sometimes, and I took the slide out, we use antibiotics to remove it if it's some sort of severe gut infection. There's a lot of traditional docs and integrative docs that will use antibiotics to wipe the slate clean, but the problem with that is they wipe everything clean, the good and the bad bacteria. So we use a lot of herbal alternatives, berberine, garlic, olive oregano. I use a lot of olive oregano with patients. The herbal things are going to suppress the pathogenic strains without wiping out all the healthy flora as well. Have you noticed a pattern? ID your food sensitivities. Know what you're eating. Good food could be killing you. I tell people this every day. You really need to know, and you need to pay attention to how you feel. Food should make you feel good when you eat. You should not be tired after you eat lunch. You should not want to lay and take a nap. Food should give you energy. So pay real close attention to how you feel. All right? Certain diets, restricting carbs, fructose, lactose, things like that. So then we're going to repair it. All right? I use a lot of L-glutamine to repair the gut. Butyrate, which is it's what gives poop its smell. All right? I use a lot of that as well. And then we're going to replace it with digestive enzymes, and there's all different kinds of enzymes out there. My advice on buying digestive enzymes are look for some that have clinical trials behind them that are really, that have some good clinical trials. Bromelain, like the pineapple and the papaya, that's the kind of digestive enzyme I started with, but it's really not strong enough for people to break down fats and to break down a lot of proteins. So I use, amylase and lipase and protease enzymes. Hydrochloric acid. And then we're going to re-inoculate it with, pre and probiotics that have clinical trials behind them. And this is something that I'm not real familiar on, which is, fecal transplants. And the problem, what's the problem with a fecal transplant where they're transplanting, poop in somebody else's gut? Does anybody know where the problem could be? Well, nobody has good poop. Everybody's poop is messed up. This is interesting. Let's see, this is Friday. Monday, I saw an 80-year-old patient of mine. She's been a patient of mine now for about 4 years. And she looks like she's about 60. She's absolutely beautiful. Born and raised in California, lives here. She said, she sat down. She said, "I love your new place, Dani. Golly, I had a fecal transplant." I said, "What?" And she said, I didn't know she had ulcerative colitis. We've never talked about it. She never mentioned it. I didn't ask her. And she went to California, and she's had ulcerative colitis for years. And she said, I started doing research on this. And she said, I got to thinking, gosh, whose poop could I use? I can't think of anybody's that's healthy enough that I could use. Her daughter's fiance, I can't remember, but anyway, they live in California. Just apparently he's a clean eater. He had what she needed, and they did it. She found a gastroenterologist out there who did it for her. She has no signs or symptoms whatsoever of and I don't know, are you all familiar with this? Well, I don't know exactly how it's done, and somebody may know and can speak to it. I don't know exactly how it's done. But so she said he was so proud. She's completely healed. No signs of ulcerative colitis or anything. She said he was the cutest thing. Her husband, he said, now, does he need help too? Because I'll help him. It was all he had to do was poop, and whatever they do to it. She's 80 years old, and she feels absolutely fantastic. I don't know. Can y'all speak to fecal is anybody in Nashville doing it? I don't know. The Mood Cure, Julia Ross.
What about you had not an email address, it was a website,
chriskresser.com, KRESSOR, Well, I'm going to finish up this last. In fact, I didn't realize I was actually almost finished. I had gone pretty fast, so it may not take 20 minutes. So we left on fecal transplants, and I learned a little bit while I was gone. I didn't know that Centennial Hospital is doing fecal transplants for C. difficile. And somebody else told me out there you could also do it with capsules, which would not be my ideal way to do that. But so again, the main challenge there is finding somebody with healthy stool to transplant. Now, this is the Dirty Dozen and the Clean 15. We're talking about gut health. Are you familiar with the Environmental Working Group? Environmental Working Group, EWG.org, is one of the greatest organizations out there. They fight for us, but they have an unbelievable website on herbicides, pesticides, toxicity load of your skincare, your cleaning supplies, your food. You can you can type in whatever lotion it is you use, and it'll tell you the toxicity load of it and how toxic it is. They have a whole section on eating clean, eating organic on a very tight budget. They are the ones who do, and sign up for their newsletters. They do a whole lot on Capitol Hill fighting for clean food and clean products and things. But they do the Dirty Dozen and the Clean 15 every year. The Dirty Dozen are the dirtiest top 12 most highly pesticide-ridden foods out there. And then the Clean 15 are, if you can't afford to buy organic or you don't have it available to you, those are the top 15 that have the lowest pesticides out there. And every year it changes a little bit, but you'll notice over there on the left, the dirtiest ones that have the most, apples, strawberries, peaches, nectarines, grapes, things that are kind of sweet. Bugs just like we do, we gravitate towards sweet, so they spray those more with pesticides. But this is a really good thing to keep on your refrigerator or what have you, and I refer patients to this website a lot. And again, when we're talking about gut health, we're talking about gut, it's not just what you put in your body, it's what you put on your body. Your cleaning supplies, your lotions, your makeup, your lipstick, your nail polish, your hair color, your shampoo, your conditioner, every single bit of that affects the inflammation in your body. What you put on your skin in the morning or any time is through your system, your bloodstream, in 26 to 30 seconds. So you've got to be real careful what you're putting on and what you're putting in your body. Breathing when you're cleaning, and we're going to talk about thyroid health tomorrow. Here's the nose and here's the thyroid. So when you're breathing in those toxins from those chemicals, it's a proximity problem. You're a few inches away here. Breathe in something very toxic, go straight to the thyroid out through the lymph system, and you're inflamed. And then we start talking about autoimmune disease and things like Hashimoto's. So it's not just what you put in your body, it's what you put on. I read something, I can't remember, women, before we ever get out of the bathroom in the morning, it's hundreds of toxins that are already on the body and in the body by the time we ever leave the bathroom. It's really amazing to me. It's scary. And baby steps, just start cleaning up things. You can't go home and get rid of every can and every bag, every box, every roll of food, every tube in your kitchen, but you can, as you get rid of things or as you use things, don't bring them back in, as fresh as possible. And this is true. Eating anything that affects the integrity of the gut will directly impair the integrity of your health. And we have to bring it back to basics, I think, so even more so now than any time in our recent history. But Daniel knew this in the Bible. He knew this, that health starts in the gut and strength does, and that's the whole basis for the Daniel fast. And this is true. You can't fix your health until you fix your diet. And we want to fix all of these things, and it's not, and we take a pill to treat symptoms, and we take a pill for the acid reflux, and we take a pill for the anxiety, and we do all of that. But you have to bring it back to basics. You have to bring it back to what you're putting in. So I tell my kids every day, putting in your pie hole, you got to be aware of what it is. Is it going to heal you or is it going to kill you? And the bottom line for me was figuring out my food sensitivities, getting digestive enzymes in there. And, what I've been told and what I've read, your digestive enzymes, you can keep those the same pretty much, for years and years if you get a really good quality digestive enzyme. Probiotics, though, we need to mix them up every 4 or 6 months. Is that what you tell your patients? Mix up your strains of probiotics, mix up, how many billion per flora you have, kind of mix them up, kind of confuse the gut on all the different strains of bacteria you put in there. So I have patients move things around. Know your sensitivities, figure out your food elimination, eat real food, enzymes, probiotics, decrease the stress in your life, set some boundaries, especially as women. I talk to women every day, we're really, really bad at saying no. We're really bad at setting boundaries. We're really, really bad at taking care of ourselves first, of putting our oxygen mask on first, and it's key. It's key because when mama goes down, I guarantee you the whole family goes down, and everybody suffers when mama doesn't feel good, speaking for the women, or to the women in here. So I tell women, we got to get your oxygen mask on. We have to take care of you. You don't need to be cooking 4 meals for everybody in the family. If those kids don't want to eat it, well, that's fine. Very few kids here have gone without meals. If they're hungry, they'll eat when they're hungry. So again, bringing back to setting some boundaries, decreasing stress in your life. What we all teach as integrative providers is, it's whole body, mind, spirit, physical, emotional. It's all connected. And what I learned in school was to treat people in boxes. You got a gut problem? Well, then you go to GI, and we take care of that. You know, you've got a hypertension problem? You go to cardiology. Here's your pill there. Everybody's psychotic, so they all go to psych. You know, everybody needs antidepressants. And for women, I've always said we turn it into treating. You could do it for three. I mean, you can treat women with three things your whole life: synthetic birth control, antidepressants, and then hormones. And that's it. And it really goes off of age. And everybody gets antidepressants. So, and there's a time and a place for all of that. But the bottom line is, when you heal the gut, you begin to see huge, huge, huge changes in your life, emotionally and physically. And I speak from experience on it, you know, and it really, I mean, truly, I mean, it's where you start. It's where I started, out of desperation in the beginning, not really understanding anything about what I was doing as a new nurse practitioner out of school. And now it's the whole foundation for what I do with my patients. So that's it. That's the last slide. Actually, it didn't. Yeah. That's just a little bit how to contact me. I run a group on Facebook that I started a year ago. I don't know if and it's private, it's closed. It has 1,800 of your most personal friends on it that don't know you, but it is community. And it is an amazing place, I think, where people heal. Leslie, you're on there, right? And people ask questions, and it's all about community. And I think that's when people heal, is when they have community. And it's a really great group. I mean, if you ask to join, I will approve you, and you can ask anything you want up there. And you'll probably have 15 or 20 people that will reply to it. Thank you. Thank you.